business. And so that's when he began penetrating the ALs and the ILs. And as a result of that, he has gotten an increase of approximately 10 admissions a month from his assisted living and independent living facilities. That's not chump change, that's a big block of business. And so that being said, I ask Stephen to please take the time to talk to all of you today and share with you how he has penetrated these assisted living and independent living facilities so that you too can use some of the practices that Stephen has put into place and grow your business incrementally. Come on up, Stephen. Thank you for doing this.
All right, I'll use this one. Thank you, Sharon, and thank you, Zeus. It's amazing, unbelievable that 55 of us are all together in this room working on getting Total Home Health better. And I remember when I started with Total, there was 3 of us in our marketing meeting. That happened at 7:30 in the morning because our office was probably the size of this right there, and the staff came in at 8 o'clock. So we needed to do our 30-minute marketing meeting, and it's just unbelievable that we have 55 of us here today. And speaking to Sharon this morning, hearing her vision, where she would like to take this 55 and possibly make it 255 and do this meeting in Las Vegas. I've been able to grow the ALF and ILF business recently. I am definitely not an expert, but it's something that I'm continuously learning every single week, every single day, working very closely with Debbie and Grace, my executive director and my DCS, to continue to grow with these ALFs and ILFs. I've done that by knowing the account inside and out. And what I mean by knowing the account, you need to know before you walk in that facility who their doctors are, who their executive director is, who their director of clinical services is, who determines who gets the referrals, the Medicare referrals. Is it the DON? Is it the marketer? Is it just a nurse? You need to find out these questions. The most important question, which I circled last night when I was thinking about this, is does the ALF or the community own their own home health agency? And what I mean by that is the communities, a lot of these big communities now own their own home health agency. If they do own their own home health agency, it's going to be a little bit more challenging to penetrate than it would be a facility or a community that doesn't own their own home health agency. So that's some of the homework, some of the groundwork you need to do before you even walk in there. Know the community, know the key players. A lot of this you can do online. I Google, I YouTube, I ask my case managers and my doctors and ask the community about this ALF, about this community, because they're our best resources. Also, something else which I've taken it a step further over the past couple of years is you want to know who the therapy company is on site, and you want to partner with that therapy company. I think that's something a lot of home health agencies are missing on the boat, is they go in there, they try to grow the business, they try to get the business, but they don't know all the key players. That therapy company is there on site, and they're usually renting space. So they're paying $1,000, couple thousand, whatever it is, to rent space there. So they have their therapist there, and their therapist's job is to get business for them. So one of the obstacles we saw in one of the assisted living facilities that we were partnering with over the years, and we weren't the preferred provider there, but we had 1s and 2s, is then we found out that a lot of our patients became LUPAs because we were starting them out of the hospital, we were doing 2 visits, and next thing you know, they were discharging because they wanted to go to outpatient therapy. So LUPA after LUPA after LUPA, we decided how are we going to partner with them and prevent these LUPAs? And that way was, a LUPA is a low utilization payment. So as a home health agency, we need to do 5 visits for the agency to get paid. If we don't get our 5 visits in, and those visits don't just have to be nursing, it's a combination of nursing, PT, OT, HHA, social worker, as long as we get 5 visits, we get our episode. If we don't get our 5 visits, it's called a LUPA, and really the company doesn't get paid, you get paid per visit, and it's not the same as getting a whole. So our job as AEs and as executive directors and DCSs is to do everything in our power to prevent a LUPA. So these LUPAs were happening over and over again, so we got together and said, how do we prevent this? Well, we need to partner with the therapy company. Because what's happening is, as soon as these patients are coming in, the therapy company is there and everybody wants to go with Susie the therapist because everybody in the whole community knows Susie the therapist. So we went and we met with the therapy company and we said, how do we partner together? Are you interested in doing part A with us? And going back a step, the therapy company on site at these ALFs, they're a part B therapy company. So they do outpatient part B. And us under home health Medicare, we bill Medicare Part A. You cannot bill Medicare Part A at the same time as you're billing Part B. So the patient has to choose whether they want to come with us under Medicare home health and get the nursing and the therapy through us, or if they want to go through Part B, the company right there with the big old gym that's there constantly, and Susie's trying to get them to come. So we partnered with this therapy company. We, couple meetings with the executive director set up, and now we have a contract where their therapist went through orientation with us and are now our therapist. So that patient that goes into this ALF, we pick up the phone and we call Susie the therapist, and she does therapy under Part A with Total Home Health, and we continue in there for the 60 days or 30 days or until discharge. And once we discharge, Susie then follows up under Part B. So Susie, this therapist, will be doing Part A under Total Home Health, and then following up and doing Part B under her therapy that's there on site. And if something goes wrong with the patient or with any of these seniors, they fall, they get a wound, they go into the hospital, Susie lets us know right away. So then we pick her back up under Part A. Really, learning this relationship has been such a differentiator. And learning it in one ALF, now we've done it and we have 4 ALFs where we partnered with their therapy company where they do Part A under us and Part B under them. And now hopefully in the future, because some of it is just going on right now, they're going to be looking out for the patients for us. So while we're out there trying to get other business, this ALF and the therapy group is looking out to trying to bring business back to Total Home Health. So yes, yes sir.
So when we contract with the therapist to bill under Part A for the initial part of the therapy, how does that benefit them?
How does that benefit them? It benefits the community, because the community is going to get the same therapist for the whole time, for the duration. The same therapist is going to be with us under Part A and under Part B. How else it helps us is home health is a big beneficiary to these ALFs. A lot of these ALFs have high insurance patients nowadays. If you ask them what their Medicare HMO population, a lot of them are 50-50. HMOs don't give the home health services that Medicare Home Health does. Medicare Home Health will give nursing, physical therapy, occupational therapy for 60 days and maybe even for another 60 days if needed. These HMOs will give you 2 or 3 visits and that's it. You're done. So the staff at these ALFs are wasting their staff, or wasting all their staff would get to waste their time or use their time on the HMO patients and partner with us and let us and trust us to be able to monitor and take care of their Medicare patients. If not, their staff's not being used, and when you speak to their executive director about this, he sees it right away. He understands. The more partnering with Medicare Home Health has more clinicians, more support, more therapy, more nursing, where if something goes wrong, we're in the loop. Everybody's in the same loop. Good question then.
Steve,
Yes, sir.
they can do Part B and Part A at the same time if it's not for the same service. In other words, they could be seeing Part B for therapy and us under the skill side. Yes or no?
Yeah, you gotta be either A or B. You can't have therapy. Yeah, no, it's either one or the other. And that's why my pitch a lot of times is please for home health. And my pitch a lot of times is please, even when they're coming out of the rehab or out of a hospital, come with home health first for a couple weeks and then transition to outpatient. You've been in the hospital, you've been in a rehab, you've had nursing here around the clock. You don't want to go home and just go to outpatient therapy. At least let our nurse come in for 2 weeks just to monitor you and to make sure we get our 5 visits so it's not a LUPA, and then transition the patient to outpatient therapy. Yes, ma'am. That's a... Right.
I asked that when you first did this, did you speak to the administrator first or did you speak to the therapist first?
I always try to run things through the administrator, But if that administrator is constantly blocking you, you know, our job as AEs is to work the building, to know everybody inside and out, from the top all the way to the receptionist, to the lady answering the phones. You want to know everybody in the building. And part of your networking and your stops in that ALF is stopping by the therapy group. And if that administrator won't see you for 2 or 3 months, I would go in that therapy group. I wouldn't let not meeting with the executive director prevent you from meeting the therapy group, speaking to the therapy group, because to the therapy group too, we're not competition. We're going to help, and this might be a conversation you have to have with the director of the therapy group, because the therapist might think it's more work for them, but the owner of the therapy group or the administrator knows the dollar signs of partnering with Part A. We're bringing him all this volume of business too. And other patients that are going to come with us, we're just going to continue growing their business through that angle. Does that answer your question? I mean, to answer your question, I would not stop with, I would try to run it through the executive director, but if not, meet the therapy group, meet the owner. Yes, sir.
Stephen, what's the benefit to the therapy group in partnering with us? I know where our benefit is.
Correct.
But what do we pitch them as what's their benefit for going Part A instead of Part B?
Financials. You as an administrator, you're speaking, these patients that are coming in, if they're not going to partner with us, we have a couple patients, we're using our own therapy. So we're using our own therapist in there and out, and we're using our own staff. But instead of that, we're going to partner with them, and their staff is going to subcontract with this. So our 5 Medicare patients that we're using our own staff to, those 5 patients are now going to be using their staff. So we've just given them 5 new patients, or partnered with them with 5 patients that they're going to be billing PT, OT, and it's from a financial standpoint. It's and that's why I said it might not be a conversation to have with the therapist, have it with the director of the therapy group.
I would say it's kind of a, you know, you want continuity of care for that patient. And if we can get the same therapist treating them under Part A, and then they just smoothly transition to Part B when Part A services are done, most of those patients don't even know that it happened. And it's a nice give and take, because somebody might be on Part A, have a fall, sustain a wound or something that they need to flip back. They're on Part B, they have this wound, needs to flip back to A. They flip them back to A so that we can treat the wound, and as soon as that wound is healed, it transitions back, and lots of times that patient doesn't know even the difference that there was anything different in there. So it's continuity of care. They know that they saw therapist Sue the entire last 3 months, and they never knew that they went from B to A to back to B, or however it goes. So there's a nice continuity. They're watching it. They know what patients fell in that facility. They will know which ones go to the hospital. They give us heads up. This patient went to the hospital. It's a chance for them that they may come back on Part A, depending on what their diagnosis. Give Stephen an opportunity to go to that hospital, flag that chart, monitor that patient. So it's a win-win. It gives us more patients, you know, to monitor. They're treating the patients, continuity and care in the facilities. They love it. You know, their patients are being seen by the same person. You know, they're making additional money, those therapists that are contracting with us to do the Part A section.
Well, thank you. And it's just starting to, even like Debbie said, we have one of our therapists in one of our rehabs that every single time, and the patients can be active with her under Part B, these patients go into a hospital, we're getting email, Grace is copied on the email to follow up with it, because that's an opportunity for us to pick it up under Part A, because if the patient's in the hospital, most likely they're going to be some type of nursing need. So let us pick it up under Part A for a couple weeks, and then transition it back to that therapist who gave us that referral. And once that relationship starts working, it will be a differentiator, especially during the summer months, because these ALFs don't see season. Their job is to have heads in beds 12 months out of the year, no matter if it's July or if it's now. And how do they do this? By bringing in new residents. And that was actually the most important thing on this list, is try to help them grow the business. I mean, this is my main motto in home health, and everybody from doctors to rehab say, how can I help you grow your business? The same thing with this ALF. Find out whose job it is to bring in the patients to the building. Do they have an outside marketer? Do they have an internal marketer? Is it the executive director's job to bring in the business? Whoever that is, that's your key. You know, besides the director of nursing who sends it, that person, because if you can help this person bring in patients, If you can help him and introduce him to our 50, 75 stops that we make a week, bring this executive director with you for a day. Have him come around to 15 rehabs and to 5 doctor's offices and to 2 hospitals and introduce him to your people. Nobody else has done that for him. Most other competitors go in there and say, give me, give me, give me, give me, give me, give me. No, us at Total Home Health, what can we do to help you? How can we help you grow your business? Because if you grow your business, we're going to grow our business. So that is always, I do that through co-marketing. Even yesterday morning, I had a breakfast at Health South, which is an acute rehab hospital. Acute rehab hospitals, they are determined on their outcomes, so they never want to discharge to a rehab because that looks bad on them. They always want to send them home with home health or send them to an assisted living facility. I had this breakfast with 15 case managers. I brought an ALF administrator. He was there networking. He got a lead or 2 out of them. If he gets those leads, they're coming to Total Home Health. So if we have a breakfast or a lunch set up, invite this ALF, invite the executive director, the marketer, because I promise you, stuff will get back to them. Total Home Health is bringing us around. They're trying to introduce us to so-and-so. They invited us to this big networking event. I mean, word travels fast in this industry. Provide community outreach, and that's something I think in the Broward office we really do wonderful. Besides doing the turkey drive for Thanksgiving and a ham drive for Christmas, we had John running around as Santa Claus to all these ALFs, and then we did the Happy Holidays pictures that we've been following up, bringing them. We also tried to plan an open house at their event because their job is to get people in, the traffic in to see their thing. How are they going to do that? Let's partner. Let's set up an event. And in this event, we introduce all of our people. We try to bring all of our people, all of our case managers to see their building. Because the more traffic they get out of there, they're going to remember who brought that traffic. And the other thing on that too is the home health agency that's sitting in this ALF, and I'm talking, bouncing around, but there's ALFs that have a home health agency sitting there. I'm sure a lot of them are paying rent and they're expecting all the business. They don't do anything, they don't have to help out on marketing, they don't have to, because they're paying rent and they expect all the business. There's where there could be opportunity, and this is where we've gotten a couple of our main ALFs that had that agency sitting in there, and we went by and we did these networking events. And we set up guest speakers where once a month we had a guest speaker coming in here, one of our behavioral health nurses, one of our nutrition, we got a dietitian to come in here and speak to their seniors. We got private duty, we did a fall prevention, and speaking to their seniors in community outreach. So when there was a divorce with that current home health agency that just actually closed their office on December 31st, and they interviewed 5 companies, they wanted to go with the company who's been visible there for the last 6 years and knows how the community works and knows their protocols. Other things we've done is monthly birthday parties for the residents. Maybe once a month, bring in a sheet cake, $20 at BJ's, a happy birthday, and they get all of their seniors there. And at that, you work with their activities director a lot of times once a month to set this up. But again, Total Home Health will constantly be in there. Total Private, bring them with them. You'll be in here. Maybe a rehab right next door that the marketing person wants to partner with this ALF. Bring them in here. The more people you have looking out for you, the better it's going to be. Something else we did was a clothing drive. Before school went back, we had boxes up front, and we asked all of our nurses, our team, to bring in any clothes that they might not be wearing for the new school year. Those clothes we brought to one of our ALFs, gave them the choice. And then we brought them to some schools or just, but just different community outreach. We also did a book drive, ALF week, there's just so many different things on our calendar. Not nobody, most people don't appreciate them. Bring them a little happy ALF week cake. Bring them happy nurses week cake. We do so many things as a company that our competition doesn't. We just got to wait for the other company to drop the ball, and then we just pick it up and run. So, that's basically what I put down. I definitely want to leave it open if anybody has any questions. It's an unhidden gem and so much opportunity in these communities.
Steve, another thing you
Yes,
said,
sir.
they'll allow you to have the meetings at the facilities. A lot of them have meeting space or
Correct.
conference rooms, and they'll allow you to have your case conference there, and then they can show the nurses or
Absolutely.
PT the facility afterwards.
Absolutely. We did that at Lennox, which was one of our ALFs, where we had our nurses meeting there. And they actually hosted, they had a beautiful spread of breakfast for us, and we had like 12, 15 nurses, therapists, and a social worker. And then we had our case conference there, and then after there, they went and they all toured the building, and a couple of the nurses, oh, I've never seen this place. It's so nice. I have somebody that might want to, but that's a wonderful point because that's, again, getting us in their building, and they might be able to identify something. And something else that you said that led to the couple ALFs that we are preferred providers in, we meet weekly. We have a thing called at-risk meetings. So we meet with their executive director of the community, the executive director of the ALF, and the executive director of the independent, as long as the rehab company that we partner with, the private duty company on site, and we're the Medicare agency. And we meet every Thursday at 10 a.m. and they go through every single patient, that there could be a need for home health, somebody is having a fall, they go through their hospital hold list, and we're just sitting there writing down potential patients that we might have to follow up on, or things like this. And as a community, they're doing this to try to help prevent their patients from going into the hospital and possibly losing it to another facility. And this is why the partnership with home health is just so crucial. A lot of these ALFs don't even know about it. They don't know what home health is. They're so crazy that they don't even know what home health, and they don't realize how much we can partner with them, how much we can offer, especially if they have a lot of HMOs, Medicare, we can send our therapists in there, our nurses in there. There's just so much opportunity. Any other questions?
Can I have a guest speaker? You said a monthly guest speaker. What were the examples you gave?
Monthly guest speaker, we had a behavioral health nurse speak in there right before 9/11. It was also the time when Robin Williams passed away, so they had a lot of depression, and it was just a rough time. So our behavioral nurse went out there, and she had 40 people, asking her questions for 30 minutes after. We also had a nutritionist come. Something I wrote down in my notes from earlier is the VA, the vet, is untapped in these ALFs. They also, with aid in attending, there are some money that could be funded for vets. So getting a vet company or a VA to do the qualifying would be a great company to speak there. Do a fall prevention, have the therapy group. There's also the tug testing. So there's just numerous different things that we can have there as well.
Have a podiatrist come in.
Have a podiatrist.
Grow their business.
Great point. And then the other main thing about these ALFs is you want to know who their doctors are.
Right.
Are they, and a lot of times the marketing people determine which doctors get the patients. So you really want to become close with that marketing person. Find out if a doctor rounds there every week. When do they round? That's a great time to show your face there. And make sure not just the ALF knows you, but the doctors know you as well. That's huge. And then a podiatry too. So besides your internal medicine primary, you got a podiatry, a dermatologist. I'm seeing a lot at ALFs now. So any other questions? Perfect. Thank you.
Thank you, Susan. All right, I just need a few men's hands to help me with the table here for our Ask the Expert section.
Would you do me a favor, Mike? Just go to the closest arm. I need those boxes open. And I don't want to use my fingernails. I'll break it.
No worries.
No, they all go here. It's Ask the Expert. Sorry. I didn't give clear instruction. So we need a total of 7.
Yep.
All right, so our top 5 account executives in the company to the head table, please. You are the experts. So that's Stephen, Ryan, Audrey, Chad, Nina. Where's our- The top 5 are probably answering their phones. And then also, I wanted Debbie up at the head table, so we have someone from operations, and also Leo at this table in case there are compliance questions. And let's see if you need to take your place at the at the table. And then we're missing, is it only Nina? All right, when she walks in, we'll send her up there. Let's give her 1 second. But while we're waiting for Nita to join us, I wanted to take a minute to remind you. Of my request earlier this week. You have top performers in this company sitting at a table in front of you. You also have an excellent clinical leader. You have an excellent compliance officer. This is your moment to ask the questions that are on your mind. And so, Julian, do we have another wireless mic? Because the head table needs one, and then I need one for the room.
There just might be some static, that's the only thing.
What's the matter?
There might be some static because let me just.
You turn that one off.
We're going with the wired. Yeah, because we were having that noise.
We're pretty loud up here, too.
Yeah, I'm gonna say,
We're pretty fortunate.
Okay. So does anybody have a question that they'd like to start out with?
Take one of them back.
They want to know if they can each have one of you.
We can stay a couple days.
Steven, my question is for you, sir. At lunch today, every time we talked about different doctors and how we make sales calls and the questions we ask, every time you said, you were talking about how you can bring business to them. So can you talk a little bit about the referral sources that you've had some success bringing business to them and what the impact it's made?
Correct. Thank you. Do I need it? Or no? Everybody here? All right, that's a very good question. Everything I do, I try to partner everybody together. It's like a boomerang marketing. I try to set doctors up where I try to find out what their need is. So I try to hook doctors up with facilities that need doctors. I try to hook doctors up with ALFs that need, everybody really needs a doctor. So trying to find if the doctor's interested in going to ALFs, interested in going to rehabs, interested in doing home visits, interested in billing for transitional care management code. Anything to help bring them money, help bring them legal money, help grow their business, because if you help them grow their business, in return they're going to help you grow their business. And that's really my outlook every single time. I always think all my competition is going into these doctors' offices saying, gimme, gimme, gimme. Give me a referral, give me a referral. I try to do things different where I go in there and say, what can I do to help you? And once I help you, you're gonna give me, give me, give me. And that's just one of the things I think that differentiates from everybody else.
The other way you can give your docs referrals is, we're just bouncing some ideas up here. In my ALF that I work for, a couple of them, but one in particular, I work with the leasing director, because she's the one that's working with the family getting them moved in. And so she's got a stack of my cards, and she gives them to the family, and then the family, some of them are moving their mom or dad into out of state or wherever else, and they don't have a doctor. So I have one doctor in particular in each area of the communities that I work in, and I just send patients to that one in particular. And I give them his cell phone or information or whatever he wants, and then that's how another way you can get some business to your doctor, create some loyalty with.
When any or each of you go to a potential referral source, and they ask you what sets your company aside from the other 500 home health agencies in your area, what's been some of your better responses to them to get that business?
What kind of doctor, for example?
It could be any type of referral source.
She wants a generic. She wants a generic. What differentiates Total Home Health from the competition?
So you want to tell them what programs we have. For example, we have behavioral health. There's not a lot of Medicare-approved home health companies that we have behavioral health. And especially now, since we have the COPD and CHF program, that is something huge that I'm just like blasting my offices with, because I see that. Those care kits, yes, because it's all about readmission. It's like how, sentiment Stephen said, is how can we help you keep your patients out of the hospital? So that's very important for them.
What office are you in?
Palm Beach and Stewart.
Who's your executive director?
Right here.
Right there, okay.
Just started.
So, in Houston, Jesse's ours, and Jesse keeps Ryan and myself and Nina updated on the new staff he hires. So, for example, we just hired a WOCN. Those are uncommon. It's a wound care and ostomy certified and continence certified nurse. They're uncommon. Most people don't have them. And so if you were selling to a wound care center, that'd be important. If you're selling to a surgeon, or if you're selling to endocrinologist, I mean anybody that's working with a wound, you know, that's a differentiator that most people don't have. So if you ask your executive director what kind of staff you have or what kind of unique staff you have, another thing that a lot of people, or a lot of companies don't have, is they don't have their own full-time therapy. They use contract therapy. It's difficult to manage contract therapy, and I know every executive director at DCS in here knows it. It's really tough to manage it. It's tough to get your notes back.
And use yourself too.
Yeah.
You. I mean, I can say not many of you have been in the company for 6 years, so it's a benefit that I have. I'm saying I've been loyal to the company for over 6 years. I've seen the company grow. I stand by it. I answer my phone all the time. Call me. I'm very reliable. You can get me on the weekends if you don't mind my kids screaming in the background. I will answer that phone. I've had so many calls on weekends, believe it or not. If I didn't answer that phone, I would have lost a referral. Even for the, like maybe on a Tuesday, but they called me on that Saturday to test me. They will test you. So I always tell them, me, I'm very reliable, and I've been with the company for a long time, and they like that. So, you know, and I touch on the programs that I know other agencies don't have. If you say, oh, we have physical therapy, everybody has that. But I'll say, we'll do daily wound care, and I know a lot of agencies won't even take wound care patients. They cherry pick. A lot of agencies cherry pick. We don't cherry pick. And I tell them, try me. I'll do ID therapy. So I'll brush on things that I know other companies don't like to do.
And talk to your
Use
ED.
yourself.
Yeah, also talk to your ED before you sell specific things like that, because not all offices
Yeah,
have the same.
To tag on to what Audrey said, that's what I say every single time. Besides having our wonderful programs, and we have more programs than everybody offers, and more, what's the word I'm looking for? CHF and tools that anybody else has. But besides that, it's me. Nights, weekends, holidays, hurricanes. It doesn't matter. If you're working, I'm working. You call me. If I don't answer, I'll call you back right away. If you have a chart review, I'll go do it. I'll go, I meet the patient, I give them my cell phone number with my card. I tell them, don't bother the social worker, don't bother the doctor. Night, weekend, call me. You know, a lot of companies have on-call services where you'll call and you'll be on hold and you won't get a response for 2 hours. You call me right away. I have our on-call number, my on-call nurse's number on speed dial. I can get her and I can